Hello everybody, welcome to the Problem Gambling All Provider webinar for February 18th. Thank you for attending today. I'm just going to go through our slides really quickly. Oh wait, let me do it this way. Okay, so like I said, and we have been in the past, we administratively mute this call and we record it. That just eliminates a lot of the background noise that we get from all the different participants on the phone. So you will not be unmuted. And you can't won't be able to ask questions verbally, but you can use the chat box to ask a question anytime during the webinar, and we will read your question and answer it at the end of each presentation. I'll myself read the questions that you have to each of the presenters. If you're unfamiliar with this technology, you probably have a box right here on your screen, and you can minimize this go-to box so you can see the whole PowerPoint presentation by clicking on the orange arrow button. Should be about right there. And then if you click on the orange arrow button again, it'll bring the box back. So the box is where you would do any of the chatting for your questions that you have. So today's agenda is we're going to start with some state updates, and then we have a presentation about what the lottery is up to by Thais Roddick. And then we're going to have Michelle Tantriella-Modell talk about the Helpline data and some of the Helpline stuff that's been going on recently. And then Tom Moore is going to present on the results of the adult prevalence study that we just completed, and he's also going to give an overview of what statewide treatment data looked like for last fiscal year. And he'll also give an update on fantasy sports and what's going on nationally and here in Oregon around that. And then you'll have an opportunity for questions and answers at the end. However, I'll take the questions after each presentation for those particular presenters so that they don't, so I'll take questions after the Oregon Lottery is done so that they don't have to stay on the line for the whole webinar if they don't want to. After the webinar's over, we will send out the PowerPoint and any documents that accompany this webinar to you that have attended, plus a CU certificate via email. So that'll either be later this week or early next week, just so you know. And we'll also post the webinar recording and the PowerPoint on the Oregon PGS webpage. So for state general PGS updates, just wanted to make sure you're aware that we have an upcoming training opportunity, the 2016 Focus on the Future Conference. This year we're collaborating with Washington State and their conference. So April 26th and 27th is the pre-conference workshops. The 28th and the 29th is a general conference. It's at the Crown Plaza in Portland. And if you go to the website listed on this slide, you will see the different presenters, registration information, and stuff like that. There has been email sent out to you about the discount that you receive. It's a 20% discount, it's a $20 discount for the general conference, and also I believe it's a $20 discount for the pre-conference workshops that we're receiving. If you look at the registration form and it tells you the different cost of the conference, we actually will receive the rate that the ECPG, which is the Evergreen Problem Gambling Council, members receive when we use the OHA code. So you'll get more emails from me regarding this conference and registration and the discount. And then there's also the subsidy form that we offer to our providers whose agencies don't cover the cost of the conference to help with those barriers. So if you have any questions about that, feel free to email me. Okay, so Roxanne is going to cover this particular slide. So go ahead, Roxanne.
Great, thank you, Greta. So one of the things that, one of the presentations that will be happening on the 29th of April at the Focus on the Future conference is Mandy Davis from Portland State University will be there doing trauma-informed care. This is important, and the reason why we have her coming to present is that the old AMH, so the new Health Systems Division, had put out a policy and procedure guidelines that went into effect on July 1st of 2015 that requires any of the providers that are receiving funds through Health Systems Division that are providing treatment or prevention type services. So if you're receiving our funds, that you do need to have a trauma-informed care policy and practice in place. So one of the things that we are doing here at the Health Systems Division is we have partnered with PSU and developed Trauma-Informed Care Oregon, and have a website where different resources and everything are being posted, as well as we're partnering with them with trainings to ensure that folks across the state are getting the information they need to be able to implement this throughout their organization. So one of the steps we have done is by bringing Mandy to the Problem Gambling Conference to ensure that we're catching all of our different providers. So we are very excited to have Mandy come. She's a very energetic and fun trainer. Good first steps in setting up your organization to be trauma informed, and looking at how, as we move forward in the future with the development of plans and policies and procedures at the agency level, that you can get those into place. So she will be presenting toward the end of the day on Friday, but we would really love to see all of our providers that are available to be there and get the opportunity to have this training with Mandy.
Thank you, Roxanne. Okay, so please try to attend. I know it is the last presentation of the conference, but it's still really important information. And like Roxanne said, we just went to a presentation last week from Mandy, and she's a really energetic presenter that can keep your attention, even at the end of a day. All right, the next announcement we have is that I just wanted to let everyone know that there is an upcoming expert webinar, and it's particularly on gambling screening. So I got an email about this. It's Wednesday, March 16th at 1:30 Pacific time. I'm sorry, I read that wrong because I cut off my screen, at 12 o'clock Pacific time. So this is a registration link, and then this is a description. And after the conference, I'll also send the actual webinar that I received about this, or the actual email that I received about this webinar, out to clinicians and clinical supervisors. If you are not on the clinician or clinical supervisor list and you're interested in it, please let me know and I can also send it to you. The other announcement is I just wanted to make everyone aware that we have a national conference coming up this summer. July 15th and 16th is the general conference, and July 13th and 14th is the pre-conference. It's in Tarrytown, New York. That's about 50 minutes north of Manhattan. And if you want more information, you can go to the National Council webpage, but I will tell you that right now they don't really have much information on there, except for that it's their 30th anniversary. So I'm thinking that in the very near future, they'll probably have some information opening up registration probably in mid-March, and we'll be able to tell you what kind of who will be presenting and what the topics will be. So just be aware of that. If that's something you're interested in, you might just want to mark your calendars for the time being until more information comes out. Lastly, like you had received some emails about a Frontline PBS presentation last week on fantasy sports. If you didn't get the opportunity to watch that live on your television or your computer, you can go and watch it at any time on the Frontline webpage. It is a pretty, if you're not informed on fantasy sports or don't have a clear understanding about what this topic is, it is a really informative report done. And even though fantasy sports are not having a huge impact on our treatment population right now, it is just something, it's a very informative TV show that you could watch. Just to let you know, our next PGS All Provider webinar meeting will be April 14th from 9 to 10:30, and this is the registration link. And after that, we'll have one on June 16th. And we don't have any meetings or trainings scheduled for the fiscal year 2016-17, but we'll be getting on that in the very near future, and we'll probably have a training calendar to announce and distribute to you in April. So just so you can get those future meetings on your calendar we should have those available for you sometime in April. All right, Roxanne, go ahead.
Thank you. So just a couple quick updates for around prevention. One, wanted to make sure that everyone is marking their calendar that March is Problem Gambling Awareness Month. The theme again for this year is to have the conversation, so it's the same theme from last year. Which really makes sense because it really does allow for to really build upon that and move the concept of really having the conversation, not only, you know, parents to children, teachers to their students, but also at the professional level amongst providers, you know, perhaps mental health or alcohol and drug providers, also having that conversation with their the population that they're serving. So it's a great theme to keep moving forward. The other component of the Problem Gambling Awareness Month is also the bigger push around the statewide artwork search for the Problem Gambling Awareness Calendar. So the artwork is due into our office by April 15th. Information went out earlier this week to the prevention providers to let them know all of the criteria, etc., for submitting the posters for the calendar to us here. And so if anybody needs additional information around that, please feel free to contact me, and I will be more than happy to help with that. There is the statewide link is also, or not statewide, national link here is included for problem gambling awareness materials that you can go to the national site and take a look at some of the materials that they have available, or documents that you can take a look at it using in your community. So go ahead and check out that link, would be great, and see what's available. Wanted to also highlight that Lane County again is hosting their 3rd annual Oregon Youth and Young Adult Problem Gambling Awareness Video Contest. Have included the link here for additional information. They're running that contest up through April 8th. Had some great videos that came out of it last year. And so if you have youth or young adults in your community that you think would be interested, please share this information with them and have them get involved. It's great fun for the youth and young adults to be able to make these videos. So next slide. So one of the things I wanted to make sure that all of the problem gambling prevention coordinators are familiar with is the Substance Abuse and Problem Gambling Program's Oregon Administrative Rule. We do have a rule where we are combined with the Substance Abuse Prevention Program at this time. And we also have Service Element 80 language that comes out in your contracts that are within your contract from the Health Systems Division and your agency. If you're a subcontractor, you will need to check in with your agency that you are under to make sure that you have the Service Element 80 language. But please take the time to become familiar with the Oregon Administrative Rule, the policies and procedures that you are required to have. Those are written policies and procedures. And be also familiar with the Service Element 80. So as we're going out from our office and meeting with folks over the next year to look at site reviews, etc., that you have that information available and are ensuring that you are in compliance with that. So if you have any questions, please feel free to connect with me, and I would be happy to talk to you about that. And the last thing I have is that there will be some new problem gambling materials available soon for distribution. And I, not wanting to get too much into Thais's presentation here soon, but we are continuing to work with the lottery around those materials, and they're developing some, and we're looking at how we can also have those available to you out in the field. And so more to come on that, and we're really excited about how some of the new materials are starting to look. So you'll be able to see that soon, hopefully, when Thais does her presentation. So that's all I have for prevention.
Thank you, Roxanne. Okay, so now for some state treatment updates for treatment providers. I just wanted to let you know that our treatment call on March 2nd has been canceled. I haven't officially announced this yet via email, mostly because I didn't want to send an email about this call prior to the one that we're having right now, and because sometimes people get confused about the different calls. So it has been canceled because I applied and got accepted to a SAMHSA Behavioral Health Leadership Development Program, and I have to attend an in-person meeting in Maryland, and Roxanne had another conflict and couldn't cover for me. So we're just going to go ahead and cancel that, and that'll just give you more time to see clients and work on paperwork or do what you need to do. Also wanted to let you know that due to the April Focus on the Future conference and our April All Provider webinar, we won't have a treatment call in April, so our next treatment call will be on May 4th. So that'll just all be included in the email, but I wanted to give you a heads up. Next, yesterday I sent out a email about the revisions to our GPMS forms, and that the new forms need to be downloaded, and you need to start using those immediately. Those forms can be found on the Oregon PGS webpage. So some of the forms were a little off on being linked correctly, my fault. But so we are getting those fixed. And the other thing I just wanted to let you know is that the Spanish version of some of the forms haven't been updated yet, but will be in the near future. And we have the GPS forms that we have in Spanish are the client survey, the family survey, and a sample of informed consent form. And we will be translating the updated satisfaction survey, client satisfaction survey, into Spanish in the near future. That is not posted on the website currently because it had some drastic changes in it. So you can continue to use the forms that are in Spanish until we get them updated, but the satisfaction survey is not one that we have available at this time. Also, just to let you know, we are not translating the termination or the client or family abstracting enrollment form into Spanish because that is a form that is actually completed by the clinician, is not given to the actual client, so we didn't feel the need to have that be in Spanish at this time. Otherwise, I just wanted to give you an update on performance-based contracting, a new pilot that we are working on this fiscal year. So because we wanted to be able to provide incentive payments to treatment providers for this fiscal year, we are looking at the data that has been submitted to Herbert and Lewis from July 1st of 2015 to December 31st of 2015. So Tom has informed me that the QIR reports have been run. They're just reviewing them. So we'll be looking at those in the very near future. So as far as the incentive payments and the data that you submit for this go around, you would have had to have that information in by now. So we'll be basing it on what has been submitted as of now to Herbert and Lewis, and you'll receive incentive payments based on that. But I did want to let you know that in the future, performance-based contracting incentive payments will be issued in October of each fiscal year, and the period of time that we're going to be looking at will be July 1st through June 30th of each fiscal year. So for next fiscal year of 2016-17, we will be looking at the data from July 1st, 2015 to June 30th, 2016. So we'll look at the same data that we're looking at now, plus the additional 6 months that are to come. And we'll evaluate your performance and your incentives based on that. So that is the cycle that we're going to use. And then the 5 bullets based on the screen are the things that we will be evaluating on and providing incentives for. So just wanted to give you a heads up on that we're going to be changing the cycle in the future about the data that we do look at. So if you didn't perform to the level that you were hoping for the first 6 months of this fiscal year, you have the opportunity to improve it over the next 6 months and receive incentives on that. If you have any questions, always feel free to send me an email, as I know that this can be confusing as this is a new way of doing business. Okay, so I currently do not have any questions, so I'm going to continue on with our presentation. Of course, Roxanne and I will take questions at any point if things come up in your mind. All right, so now we're going to have a presentation by Thais from the Oregon Lottery on what the Oregon Lottery has been up to lately.
Thank you. Greta, am I driving the slides or are you?
I'm going to drive the slides, so just let me know when you want to move forward.
Perfect. Thank you, everyone, for the opportunity for us to present during this webinar. Greta, if you could flip to the next slide, please. Our agenda for today is we want to talk about the National Problem Gambling Awareness Month materials. We're going to review some website data with you for November, December, and January 2016, and that's for the opgr.org. We're going to provide you with a video lottery update, an update on our new problem gambling TV spots, which are called Couch, and also an update on the digital advertising materials in Spanish that I shared earlier last month with the Problem Gambling Services Multicultural Committee. So if you could please go to the next slide. Our National Problem Gambling Awareness Month materials, every month we produce posters that go into our retailers, and this year we added this small booklet. It's a card-sized booklet folded that has plenty of information and a lot more than our typical card has. So it has information about keeping your entertainment entertaining. It has information on Gam Talk for people if they want an additional resource to talk, and obviously also the opgr.org information with treatment and the phone number. That's the current version that you're going to see at our displayed at our retailers, but we're also working, as Roxanne mentioned earlier, with Greta to have an updated format for you with some changes in language, but the same kind of look and feel, and it's a folded small card-sized booklet. And you're going to see when I flip to the next slide where it's placed. But before I do that, this is the poster that you're going to see at all of our retailers. We are distributing that starting next week, and our field service reps are going to be placing them at the retailers, and it carries the National Problem Gambling Awareness Month theme of having the conversation, and talks about March being Problem Gambling Awareness Month. So if you flip to the next slide, please, Greta. Once March is over, we flip to the other side of that poster, and it will say "Play responsibly, keep your entertainment entertaining." And that's both materials that are up on our retailers, so they'll have one or the other. They'll either have this easel, this clear acrylic easel that you see on the left, or they'll have this flip frame that will be posted on the wall that you see on the right. And we produced and purchased these little booklet holders that you see on the bottom right corner, and they will be placed on these materials throughout our retailers. So this booklet is in addition to our current problem gambling brochure. So it's one more item that players can pick up and receive more information. It's also very discreet and easy to pick up and carry with you. So it's an addition to our ongoing problem gambling materials that we have out there for our retailers. And we're going to be producing the Have the Conversation poster. We're going to be making modifications and making that available to you. We're going to produce 6,000 posters, and we're going to do 15,000 of the little booklets. So that should be coming soon. Next, we're going to review the opgr.org data for November, December, and January. If you could flip to the next slide, please. Thank you. November saw slightly higher clicks than the next 2 months, and still pretty high numbers, 84,000, a lot of them coming from Facebook, and that's just a trend that we're going to continue to see as I believe now 53% of all adult U.S. Population will be accessing Facebook once a month this coming year. So it's really picking up steam and becoming the place where people go for information and or news. The next slide talks a little bit about December months, and those slightly down. And next one is January, slightly down as well. And it's just a seasonality, so we'll watch for February numbers and see how they perform. We're going to move on to our video lottery update, and this is so we're starting as of February 8th. We started advertising our video lottery products on television, and the decision behind that was to responsibly increase the video lottery player base and grow awareness of our new video lottery games. Our goal is to have more people playing a little bit as opposed to few people playing a lot, and television provides a great opportunity for us to convey our message, as it is a mass media and reaches a lot of people that gets access to that. And I'm hoping that we can play the spots. If you click on it, it will show the first one, which is Washington Trail. My apologies, it's not coming through with sound.
I think it might be, Thais, I think it might be due to the webinar. I know that it did work yesterday. It works on the PowerPoint, so maybe we can post the PowerPoint on our webpage and people can watch it.
Are available. These are also available on YouTube. If you go to the Oregon Lottery YouTube channel, they're posted in there. But if you wouldn't mind playing the time limit one as well, Greta, so we can see just kind of the message there is the play responsibly. I'm going to have Stacy give a little bit more background on the Lewis and Clark campaign.
Yeah. Good morning, everybody. This is Stacy Shaw, Assistant Director of the Oregon Lottery. Just wanted, it's very hard to get the message behind this campaign without sound, but and you're probably wondering, what are all those people dressed like that for? This is a campaign based on the idea of Lewis and Clark, and they're discovering, in addition to other things, Oregon Video Lottery. What we really want you to notice, though, is there is the first one we played was called Washington Trail, and that is in promotion of the product. But what we do anytime we do product advertising is a responsible gambling message that's done in the same style, so that responsible gambling isn't just about terms and conditions and noise that nobody listens to. It takes the campaign that we're running and makes the responsible gambling message normative. So the second one that you saw, and I would encourage you to go look at them on YouTube, because A, I think they're funny, and B, you'll understand what we're trying to do. But the second one, called Time Limit, has Lewis telling the large gentleman that by the position of the sun, his time is up, and that he should always be playing responsibly. So that is just something we do, and we've been committed to doing, which is to weaving an RG message into all of our product advertising. So.
So if you flip to the next slide, please, Greta, I'll show you the schedule. So, oops, sorry, one back. So this is the spring TV advertising schedule. So we started on February 8th, and we are running it next week again. Then come March, we're going to be running the time limit spots the first week of March and the week of March 21st. Then we go to, there are two more versions of the spots, one called Package Home and the other one called Makeup Time, and we'll run those in April and in the later part of May and June. But if you overlap that with what our efforts are doing for problem gambling and responsible gambling, you can see that our messages are concurrently running at the same time. So we have about 8 weeks of video lottery TV purchase. We have 11 weeks of problem gambling and responsible gambling, and if you count the 2 weeks of the time limit, it's more like 13 weeks. So promoting it responsibly, we always have the two messages going on at the same time. So the next update is our new problem gambling spot, and it's called The Couch. And there's actually two spots, and I'm going to do you a favor and not try to enact or read, because I was not born to be an actress. But the story really is about a couple and talking about holding up their end of the deal, their end of the relationship, and how when one of them was going through gambling addiction, he was not handling, he's holding up his end of the relationship. And we'll do two versions of the spot, one from the point of view of the problem gambler, and then one from the point of view of the wife. You know, there's a funny line saying, you know, people used to say, I had a gambling problem, it was you. So it's really targeting and communicating to the significant other, and to making sure that the message is conveyed that help is available to the significant other as well, in addition to the problem gambler. So, and we'll show you, it will start airing mid-March. So by the time we have the next webinar on April 14th, it may be old news, but we'll play it for some of the folks that may not catch it on TV. And then the next slide and last one is just an update on what we're doing with our digital advertising materials in Spanish. So about this time last year, a little bit earlier, we translated opgr.org to Spanish and went through a very comprehensive review to make sure that all the pages were, were culturally relevant. They had the right content and materials in there, and we wanted to make sure that we promoted that page in the same robust manner that we promote the opgr.org page. And we created ads that are culturally relevant to the Hispanic audience. These were all locally produced with a agency, and all those are original photographies. And we came up with a copy that really kind of emphasizes the same themes that you see on our regular campaign, which talks about the other woman. And this one says, you know, the first one on the left says, La otra mujer puede ser las apuestas, busca ayuda. The other woman could be the betting, could be the gambling, seek for help. And as you can see on some of these materials, we are not just showing our terminals, but there's some card games, and there's some common themes. Those are the top performing ads. The top 4 are Facebook ads, and the bottom 4 are Google search. And on the right corner, you can see what the terms are that people are searching more frequently. So it's I need money, necesito dinero, fast loans, quick loans, juegos, and then gambling addiction. So these are performing. I think the next slide tells a little bit about the story of how they're performing and how much clicks they've drove into the opgr.org/es website. It's really phenomenal growth, going from close to 2,000 clicks in September to close to 6,000 in November, and hovering around that for December, January. So really good info to make sure that we have it available for all of our audience and all the people that may be looking for help, that they're available in a variety of languages and formats. So. And that's it for my presentation. Do you have questions?
Let me see if I have any questions. I'm not seeing any questions. So thank you, Thais, for coming and sharing that with us. We're really excited about the new materials that we're going to receive. And just for you guys to know, I was in a meeting where they did a reading of the new couch advertisement, and it's really exciting because it really has a really impactful message attached to it. So I'm really looking forward to seeing that being produced.
It's being filmed as we speak at Sisters, so it's going to be fresh off the press come mid-March. Thank you guys very much for the opportunity.
Thank you. Okay, we'll move on. Okay, so now let me find Michelle and unmute her. Okay, Michelle, you are now unmuted. And so, Michelle.
Hi, Greta. Hi, everybody.
is going to give us an update on the helpline data. Go ahead.
So I have a quick question, Greta. You saw couch. Excuse me. You saw couch. Is it animated, or is it
I saw it as sketches.
storyboard? Storyboards.
Yeah.
Okay.
And it is not animated. It is actual
Okay.
people.
Okay. Great. Great. Thank you. So I'm Michelle, the director of the Problem Gambling Helpline, and I'm hoping you all are receiving monthly reports on the number of calls and how many folks and who, not who, but how many people were referring to treatment, and particularly in your area. The numbers for January, things have stayed pretty stable for actually a couple of years now. January, we referred 88 people to treatment throughout the entire state of Oregon. That was up a little bit from December of 2015. We have not noticed uptick in the helpline calls or actually chat. It still stays pretty stable. So, I mean, I don't even know what to say about that, except that it's been stable for several years now. And luckily, because of what the lottery is doing, there's other means and ways in which people can reach and have resource to the page. So I'm hoping that even though we're not getting it through the helpline, that folks are accessing the providers right off of the Oregon Problem Gambling resource page. That being said, Shad and I and Greta spoke last week, and we're going to move gear, which is kind of hidden on the web page, up a little bit so it has a little bit more presentation on the page. And I don't know if any of you remember, but on the last web page, it was right on the first page. It was one of the ways that we showed that we did have gear. And so now it's layered. It's back there under resources and I think under treatment, if I remember correctly. But you have to go looking for it. So we are going to move it up to the front page. It's just going to be on the top bar. And then on the very bottom bar, just saying that we have a home-based phone counseling. Very simple, but at least people won't have to go digging to find it. So we're excited about that. Actually, that's really all I have to say. I'm more curious if folks have questions to us. I do want to remind people if there are any changes to your information, please let us know immediately so we have the accurate provider information for the helpline staff to use and to put on the web page. But are there questions for anybody about the helpline? Any issues you're seeing, any concerns you're having? You can ask questions now. Please feel free to call me, email me. I'm always open to receiving any information that I have from all of you out there because we're here to serve the state. We're here to serve all of you providers. So please contact us if there's any questions or concerns or if you have questions right now.
So I haven't received any questions from anybody, Michelle, but thank you for presenting. Yeah. But I did want to let you know that so I put the website address where you can find the monthly helpline data. We don't actually send it out to providers, but we do post it on this webpage. So you can access it at any time, and you will find data from July 2015 to the current. I think it's up through November right now, so I think I need to post December and now January. But so you can do a comparison to see how your months are going. If you would like data further back, we do have that available to you. Also, we just didn't post it online just to keep the page a little shorter and simpler. So you can always request that from us or from Michelle.
Yep.
Okay, well, then we'll continue on. And if questions come up about this later, you can feel free to ask because Michelle will still be on the line and can answer. Okay, so now we're going to hear from Tom Moore, and he's going to just overload us with data and information. He's going to tell us about the results of our adult prevalence study and what our treatment system looked like for last fiscal year, and an update on fantasy sports. So, Tom, you are unmuted. Go ahead and take it away.
Thank you. Next slide, please, Greta. And Greta, congratulations on that federal training program. That is a big deal.
You know,
I didn't know that.
What I forgot to say to you guys is that so it was a leadership program that was open to all behavioral health managers across the nation, and so I applied, but I really didn't feel like I would get accepted because I work in problem gambling, and typically SAMHSA doesn't really acknowledge problem gambling as a behavioral health in the behavioral health field the way that we had hoped. So getting accepted, I was really shocked, and I think it's really encouraging because I think it's a good step for SAMHSA that they're acknowledging problem gambling, and that maybe I can contribute and spread that word through those that I'm going to be working with.
Okay. Neat. What I'm going to go through now is the preliminary findings, and as some of you know, we're kind of overloaded here in my shop with a couple studies and everything else going on. So what we wanted to do was run some preliminary data for the major funders, which was the Oregon Health Authority and the Oregon State Lottery, just to give them an idea of what's coming out of that. Over the next several months, we're going to be doing a much more in-depth analysis of all of this, and we'll come up with a formal report. But right now, we're actually about ready to go in the field with the adolescent study, so my priorities are shifting. First, I just want to go over some of the participation rates. When you look at this chart that's out of the draft report, you look at past year, 1997, past year gambling was 70%, then dropped down to 59%. And then popped up to 64% and dropped down to 56% last year when we collected the data. When you look at that and you compare individual years for past year, you kind of go, well, what's that mean? That's kind of up and down. Does it tell us anything? We ran a simple linear regression through those 4 data points, and again, it's only 4 data points. But what that basic analysis suggests is that past year gambling, even though we've had the ups and downs, but over the time that we've done these studies, past year gambling is actually going down. So that kind of fits with some of the other information that we have anecdotally. The lifetime gambling rates, you see those bounce around too, and that when we ran a simple linear regression on that one, the line was pretty flat. But what I dropped out the 1997 first year, and you look at just the last three studies, and we're seeing a sizable upward trend of lifetime gambling is what we'd expect. So I think one of the things here in Oregon, I think we're really blessed to have some great folks in positions to fund these studies, and we've got some longitudinal data that we can look at that we can analyze over all four study projects and come up with some really interesting stuff. So again, past year gambling trending down, lifetime gambling trending up. Next slide, please. This is what we asked folks was in the past, went through all the different kinds of games and asked them if they had participated in that gambling activity over the past 12 months, and then just a really general question about what their typical monthly expenditure was. So this is not rocket science; it's a generalization, but it's the same methodology we've used for the last, for all of our studies. And Rachel Volberg is consulting with me on this project. So those questions are pretty standard across a lot of jurisdictions. The most frequently played game was traditional lottery games, followed by video games, combined poker and line games, 19.2%, Keno, 5.6%. Casino IGC, 19.8% of the folks reported gambling. You can see that the folks that went to casinos, those that bet and that reported an expenditure, the average typical month was $122.3, which is much higher than what we see for the other activities from the lottery activities. We ask a question also about what we're looking for is day trading in stocks and bonds, and you see that there was only 7% of the folks participated in that, and I'm still looking at that data, and I put an asterisk beside that $4,430 because I'm suspicious. I think maybe some of the older folks got a little bit confused about how much they had in their retirement plan. So we're again looking at that one. But you can see the frequency of play, and when I get down to fantasy sports in the presentation, I'll talk a little bit more about that. But you know, the horse racing animal contests are only 1.8% of the population. Dice is a game that's of our population. It's only 1% of the folks. So that's kind of the information that we have. With the expenditures, we'll be looking at that, you know, for this year and for the 2006 data and other data to kind of look at that. And we're also privileged to be working with what's called the Problem Gambling Resources, the Partners Group. And so I'm looking forward to the lotteries researcher is we're working together and hopefully can be able to look at a lot of different data sources to make sense out of everything. So I think it's kind of exciting times for those of you that are interested in research, and I think there's probably an N of one on the call. Next slide. It's terrible when you're laughing at your own jokes. What we found was essentially no change from the 2006 study. We used a different instrument. We used two instruments. One that we've used in all the other studies, and that change was 1/100%. So essentially, we're looking at the same rate that we reported in 2006. So that's good news. That all the stuff that's going on with the health authorities' prevention, with the lotteries, responsible gambling, that appears to be having a pretty nice effect of keeping the lid on the prevalence rates. One of the things that we are working with this year is that there's been a tremendous amount of research internationally in the field and looking at viewing rates and trying to standardize those rates. So I'm not going to go into that. That's a 2.5-hour lecture, and sometimes I confuse myself. But we will be talking about that in the final report when that comes out. So anyway, good news, no change, no increase. Next slide, please, Greta. We did ask some attitude questions, and some of these I thought were pretty interesting. The first one was benefit outweighs the harm, harm outweighs the benefit. 32%, 32.5% reported that harm far outweighs the benefits, and you can see that the benefits far outweigh the harm. This is kind of an interesting slide, and go ahead to the next one, Greta, please. This is what's interesting, is that we see these kinds of different attitudes, and yet we would, you know, sort of get the feeling that there may be some where people feel that gambling is morally wrong. This study certainly did not show that. 76% said no, it's not morally wrong, and 2.8% didn't know. One of the things that was interesting, I monitored a lot of the calls just as a quality control for what the PI does for these studies, and a lot of people had difficulty answering whether it was morally wrong. And some of the questions, some of the answers of some of the folks were typically like, well, if a person has a problem with gambling and they continue to gamble, then it's morally wrong. So I think this is a really interesting finding of the percentages. Next slide, please. Oh, excuse me, before you go, the no differences means there was no differences between males and females, and no differences between the 18 to 34 and the 35 and above age groups. And those were the four main cells that we looked at. Next slide, please. Legalized gambling. 25.2% said all types of gambling should be legal. Some types of gambling should be legal and some should be illegal. Was the majority, 56.3%, and 12% said all types of gambling should be illegal. The younger folks were more likely to fall into the some legal, some not legal, and that the age group, both males and females, were less likely to endorse all types of gambling being illegal. So we're seeing some differences between the ages. The older folks are more conservative on that, and the younger folks are more open to that activity. Next slide, please. Gambling opportunities in Oregon. 27% said gambling is too widely available. I'm going to skip over the green one. And 62% said the current availability of gambling is just fine, and 5.5% didn't have an opinion, didn't know. And guess who said the current availability, the gambling is not available enough? Males. So kind of gives you a hint of where some of the males' minds are about the gambling, even though that's a pretty small percentage looking at this sample of a little over 1,500. Again, I find that very interesting. Next slide, please, Greta. When I was analyzing the data, I ran this data, and when I first ran it, I thought that I'd got the coding for males and females mixed up, because I was really, really surprised that almost 85% of the folks in this sample were aware that treatment is available in Oregon. So that, with the advertising that the state lottery is doing, and the work that prevention and treatment folks are doing in the communities and stuff like that, that message is certainly out among Oregonians, and I think that's fabulous, because we haven't seen that in the past. The 35 and above were more likely to be aware, so they're the ones that are probably paying attention to the TV and media ads and stuff like that, and that's just a guess. What was interesting, it wasn't statistically significant, but the older males were slightly more aware than the older females, and the 18 to 34 males were less aware than that age group females. So one of the things that we know when we do these kinds of studies, the way we did the study in 1997, we had a lot of landlines. Cell phones were just coming into being. Now the whole world has changed. People are getting their information in different places. So, but to have 85% of the folks aware the treatment is available in Oregon, I think is phenomenal. For those people that were aware the treatment was available in Oregon, we asked them a follow-up question of whether treatment is effective. So 47 point, almost 48% said yeah, they believe the treatment was effective. About 8% said no, they believe the treatment is not effective, and a whopping 30% really didn't know. Females were less likely to say no, and the over 35 were more likely to say that they don't know. So just some interesting stuff. I think we're going to be dealing with this data for a long time, trying to ferret out what does that mean? What does that mean for messaging and stuff like that? But we've got a great baseline on awareness and attitudes. Next slide, please, Greta. And then the question we also asked was, are you aware of any radio and TV ads regarding problem gambling in the last 4 months? We know that putting a time frame, the respondents telescope, so it can go. People can you ask them, what'd you do in the last 4 months? They may look back for a year, and other people may look back, 4 weeks. So this is kind of a rough indicator, but still 64% of the folks reported that they had recently heard recall TV and or radio ads regarding problem gambling. So that's a huge. I'm not a marketing expert, but from my marketing classes back in 1966. I think that's pretty big. And we were in the field from July 31st through October 20th. And the other thing that I think is important too is that there were no significant differences between males and females or between the age groups. So the message, again, the takeaway from all of this is that the message is getting out there, and what's being done in the state is good stuff. Next slide, please, Greta. This was Roxanne's going to kill me for saying this, but this was another one that really surprised me, and I've changing my own perspective. 73%, almost 73% of the folks reported that they felt that gambling problems are preventable through education and awareness. I think that's big. Only 7.7% didn't know, and 20% said no, it's not. So I think that's a good piece of information. It's a great baseline for future studies. The 18 to 34-year-olds were much more likely to say yes than the older folks. And again, kind of the difference between the age groups is reflected there. No other significant differences though in that response. Next question, please, Greta. This is the first time that we've had population data, and what we wanted to do was to get a baseline, because there's been a lot of talk and discussion of is social gaming a potential entry point for gambling and problem gambling. So we wanted to have a baseline for social gaming. 834 of the folks responded that they did that. Of those, only 13.3% reported spending money. So the typical month, and what we asked in that was, did you spend money on purchasing tokens, points, and virtual goods, and those kinds of things. When we were doing the pilot, there's not a lot of information in the world about social gaming from a research standpoint. There's some international stuff that's done, and we relied very heavily on that. And we were doing some training and testing with the Portland State University, who did a great job collecting all the data for us. And we were doing some testing on live calls, and we were taking a break, and this young man came up to me and said, Tom, you're not looking at this quite right. And of course, my feelings hurt, because I thought we had, all the latest stuff. He was a gamer, a really serious gamer, and he helped us change some language there in the piloting of that. So that was kind of some exciting stuff. 18 to 34-year-olds spent more money than the older folks. Males overall spent more than females by quite a bit, and the younger males spent quite a bit more than the older males. So we're kind of seeing this male phenomenon with this social gaming question. It was also interesting in sitting and listening to these questions. A lot of the older folks, the callers had to explain what we were talking about, playing on any kind of electronic device and going through cell phone, gaming device, blah, 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 and then going through a whole list of games and stuff like that. So there's really a gender gap out there around the technology and around the games out there. But anyway, so that's a baseline for us. I think it's kind of exciting to have a baseline, and then we can begin to down the road in the next 5 or 6 years, 15 years, is begin trying to track if there's a connection between that. Next slide, please, Greta.
Tom, before you move into our treatment system, there's just one question about your prevalence study results. Of the roughly 19% that played state poker machines and line games, is the prevalence rate of problem gamblers higher within that population?
We haven't drilled down. One of the problems is that what we're dealing with is the number of problem gamblers is really small when you're looking at only about 1 to 2% with problem gamblers. So I don't have the definitive answer on that yet, but we will have that in the final report.
Okay, thanks. Go ahead and continue.
So, alrighty, shifting gears, the treatment system performance. We had, as you can see, this is one of my favorite charts that people look at and they go, oh wow, it looks like organ pipes. We did have an uptick of almost 5.5 to 5.6% over fiscal year 13-14. So we had 1,182 gamblers enroll and 150 family members. So you can see the last 5 years we've really kind of been going up and down and up and down. So I think that's an interesting phenomenon based on our history. We sort of had a feeling of why the big dip following fiscal year 7-8 and 8 and 9 was partially due to the economy, but we're still kind of looking at that, and in the annual report there will be looking at different demographics of folks coming into treatment. Next slide, please. I just wanted to, for bragging rights, you folks that are on the call, the top 10 largest programs in the state. Last year, Lane Emergence 108, Washington, Tualatin Valley Centers 106, and Multnomah Cascade 109. And you can see on down there we had a lot of programs with onesies and twosies in there. So just kind of to give you an idea of where the numbers are and what's producing the numbers in the state. Next slide, please, Greta. Also for the specialty programs, Bridgeway Residential had 56 gamblers. The Gear had 37 and 6 family members for a total of 43. And Options for Southern Oregon, the respite program, only had 4. So I think that looking at potential capacity for all those programs, especially respite, I think there's probably some underutilization, and I know there's conversations going on about that. Next slide, please. We've been talking about this for the last about 5 years, since the drop. The access source and trends. You can see that as the lottery advertising came back, the dashed red line, calls to the helpline have increased. Folks coming into treatment saying where they got the treatment information was the helpline. We saw an uptick too in the previous clients. That's sort of the brown line there. And the other stuff was kind of relatively flat. A little uptick in the web, and in that all other, that blue line that starts on the left, really the highest and kind of remains above the helpline. Again, that's a whole plethora of access points, and again, it's onesies and twosies. But those onesies and twosies really add up system wide. So again, it's going out there and beating the doors, knocking on the doors, and doing the community work that's helping to move that one up. So I think that's a reflection of the work that's been done by the treatment providers too. Next slide, please. Primary gambling activities. This has not been much of a change. Machines, the primary of the folks coming into treatment, 91%. Keno, cards has been kind of bouncing around 3 to 4 to 5%. You can see where the folks that are playing the machines that are having problems are the ones that are coming into treatment. Primary locations, as you would suspect, Oregon State Lottery video retailers, 72% of folks coming into treatment reported that was their primary location for gambling. 12.2% said casinos, and 10.8% for Oregon State Lottery others. Gender in the gamblers, again this year we've seen a decrease there. For a while we had more females coming into treatment than males, so we're still that's still down a little bit. Males were more likely to report, significantly more likely to report video poker, and females more likely to report line games. Again, that's no surprise. That's been pretty evident. And then that last that table 4.2, you can see how that's split up between males and females from video poker, slot, mechanical reels, and video line games. So there's some differences there, significant differences. Next slide, please. Oh, this is like Greta said, we're in the process of doing the final edits to the quality improvement reports, and we just ran some numbers. So statewide, 83.9% of the folks completed their enrollment surveys. Again, we're looking for 95% because we've cut back on the record abstracting form, especially for the enrollment one, and we are really relying on those completed surveys for our program evaluation and tracking system performances. So there were 11 agencies that achieved that one, the 95%. So that's coming up. It's good, but there's a lot of area for improvement. 50% of the annual penetration rate, we all know that that's a continuing issue. One agency exceeded theirs. It was a small agency, but they'll know when they get their quality improvement report. Again, the seeing folks within 5 days, that system-wide, that has been one of the really outstanding points. 96.9% of the folks coming into treatment had an available appointment within 5 days. 23 agencies achieved that. So again, that's a huge benchmark for the system. Based on what we suspect with gamblers, if they don't get in quick, they're not going to come in. And reporting, folks are still having trouble reporting. The major problem is across the board is getting the discharges to us within 90 days of last service. I know some agencies have implemented some various protocols where they're tracking folks and they're getting the information into us. Only 4 agencies achieved the 90% reporting across the board, and we're still working on the 50% greater money on treatment. So we're doing good, and there's a lot of room for improvement. Next slide, please, Greta. Fantasy sports. I wish we had the mics open. I don't know if any of you were around back in the late 90s, 97, 98, 99, when all the poker tournaments were really the big thing, and we were hearing about the poker tournaments and all that kind of stuff. I was just kind of tickled that that's kind of the talk about that's kind of become a norm, and we're not looking at that as much as we were. But now fantasy sports is on the screen, and it's gonna pop in there. So this is just an update from the presentation that Jeff and I did back in October, and if you didn't get to hear that presentation, Jeff did a really great job of explaining what fantasy sports and daily fantasy sports are. And again, the daily fantasy sports or weekly fantasy sports, the frequent play, is the activity that we're most concerned about. Without getting too much in the history, the folks that are marketing these activities big time say it's a skill game and it's not gambling. In October, we talked about the National Council on Problem Gambling came out with a resolution that essentially said it was gambling, and then the Oregon Council on Problem Gambling, we finally finalized at our last board meeting. We've been working on that. But yeah, it sure looks like gambling. Quacks like gambling and looks like gambling. National status, this is of a couple days ago. There's 11 states that have either said that fantasy sports, daily fantasy sports, is illegal or that it's gambling and it's being regulated. And Washington to our north is one of those states. 16 states have laws under review, and one of those is our neighbor to the south. And 23 states where it is currently allowed, if you will. I use the term legal. There's a lot of discussion on it, but Oregon is one of those states where it is not necessarily considered illegal in the strictest sense, and there's not much discussion at the legislative level of doing anything about that. The concerns again for fantasy sports that it's deemed high risk, especially for younger males. And we look back at our prevalence data. We look at the online activities. We look at the younger males in those areas, and with gaming and that kind of stuff. So I think that's certainly a true expectation that it is a higher risk for younger males. And the other concern on a national basis, from the National Council, is that in looking at all the laws in the states, they're not addressing consumer protections. So that's still one of the concerns, even with the states that have said that it's legal and are monitoring that. This information comes from that website there, that Frontline, and Greta had talked about that Frontline video that's on there. So if you're interested in that, I would certainly go view that too again. Next slide, please. What we do know in Oregon, we do have a baseline finally, and like I said earlier, 2.7% of the adults played in the past 12 months. And this Males are 4 times as likely to report playing. Of those, 18, almost 19% reported weekly or daily play. So that is a concern of those folks that are engaging in fantasy sports. 77, almost 78% reported playing monthly or less frequently in the past 12 months, and 3.7% averaging 2 to 3 times a month. Typical expenditure for those that reported expending money on that was about $133. So that's kind of the gist of it. Next slide. We know a lot. We're discovering more. We've got a tremendous amount of data that we're sorting through with the state data, with the prevalence data, with the data that our good friends at the lottery has, willing to share. So I think it's exciting times, looking at where we're going and getting more of that information out to the field. So thanks for listening.
Thanks, Tom. So I guess the good news is our some might be slightly disappointed, but our prevalence rate has stayed the same. But the good news about that is that it hasn't gone up, and that's pretty remarkable in the last 8 to 10 years with all the new technologies that's out there, and just different availability and options around gambling. So I think we're doing a really good job. So I don't have any questions from your presentation, Tom. So if anybody has any questions about anything that was presented today, now's your opportunity to ask those questions via the chat box, as those are all the presentations that we have today. Otherwise, just at the end of the presentation is the contacts for our office, just in case you needed them. And like I had mentioned, we will send out this PowerPoint and your CU certificates in the near future. And we'll also post the PowerPoint and this webinar recording for those that couldn't participate, or if you want to listen to it again on our Oregon PGS webpage. So it's 10:17. What we'll do is just go ahead and stay on the line. And here I do have one more question. Let me see where it starts. So David, of course, would like to see the program census slide again. I'm not really sure what slide that is. Is that about from you, Tom?
Is that the top? David, is that the top 10?
Okay. Wait, did I pass it? Was it this
Forward.
one?
Yeah. There.
Okay. That's all I wanted. He just wanted to see it again. So otherwise, no other questions. Let me check in with Roxanne. I've muted her, so I'll unmute her just in case she wants to say anything else.
No, I'm good at this time. Well, actually, I do. For those prevention folks on the line, please do take note from the one slide that Tom did share that the percentage is high of folks that believe prevention and education and awareness is working. So take that back, tell your bosses, tell your community, and let's keep up the good work. Can you guys hear me now?
Yeah.
Okay, so take back the information. Prevention is working. We're really happy about that. So that's all I've got.
Nice job, Roxanne. All right, and so this is the last thing I want to mention about the Focus on the Future conference. We've heard that if you're planning on staying up in the Portland at the Crown Plaza for that conference, that you should probably get on it to book a room, as we've heard that the rooms are going fairly quickly up there. And also, just one thing I forgot to mention about that conference is that the early bird price for that conference ends, I think it's April 1st. So if you're planning on going, you want to get that all taken care of. You want to get registered or your approval process through your agency in this coming month of March, because you want to get that early bird price. All right, let me see. I have another question. Maybe.
I answered her, Greta.
Oh, okay. All right, well, if you guys have any other questions, always feel free to contact either Roxanne, myself, or Tom. And if the question's for Michelle or Thais and you don't have their email contacts, we can always forward that to them. Otherwise, I'm going to let you go 10 minutes early and get back to your busy day. And we hope to hear you on our next webinar on April 14th if we don't hear from you sooner in some other way. So have a great day, have a great rest of the week, and make sure that you guys all take care of yourselves because we know how hard you work out in our fields. So talk to you soon. Thanks. Bye.